the first point about X-rays is they're cheap, which is sometimes a plus point. They're also very quick to perform, so within a split second the X-ray is done. That naturally lends itself to X-raying people in different positions if you want to. So we could X-ray somebody in a bent position, in a bent the other way position, for example, if we were suspecting there was a bone in their lower back which was shifting out of place, which is something that can happen in a condition called a dynamic spondylolisthesis. The other point is that they are good at showing up bony detail, so if we're suspecting a fracture, obviously, then an X-ray is a good investigation to do. The downside, however, is that X-rays will only show those bones. It won't show any of the soft tissues, any of the muscles, the ligaments, or the discs, or the nerves. And also, you do get a dose of radiation when you have an X-ray, so there are downsides to X-rays as well, and they have to be weighed against the rewards. You might be able to tell I love MRI scans. MRI scans are great for looking deep inside the body. There's also no radiation, so they're a lot safer than things like X-rays and CT scans. And as well as showing up, whilst they may not show the bones in quite as much detail as an X-ray or a CT scan, they do still show the bones, but they also show all the other soft tissues as well. So we will see ligaments, you'll see disc, you'll see muscle, you'll see nerve. You'll even be able to see fluid and inflammation around damaged structures that you just simply won't see on X-ray and may not even be aware of from the clinical assessment. So as I say, they're great for looking at deep structures. So for example, to give you a couple of examples, if I was thinking somebody had a torn cartilage in the knee, MRI scan. If I thought they had a torn cartilage or a torn socket in the shoulder, definitely an MRI scan. If I wanted to demonstrate and be sure that a patient had a slipped or bulging disc, MRI scan. If it was a cyst, I suspect some sort of cyst in their spine, that can happen in one of the joints in the spine, again, you're only going to see that on MRI scan. I think there are very few downsides to MRI scans, apart from perhaps the cost. They do tend to be a bit more expensive, let's say, compared to an X-ray. The other thing as well is that when you get an MRI scan done, you're almost always going to see or read on the report some amount of wear and tear to a greater or lesser extent. And that may or may not be relevant to the pain you're in. So it's very important to remember, or me to remember as a clinician, that I'm treating the patient, not the MRI scan. And the findings have to be correlated and put into context with the clinical assessment. One thing I will mention about MRI scans though is that when you have an MRI scan done, they'll always be reported on by a consultant radiologist. Now that report is only ever as good, to be honest, as the consultant reporting on that report. And I've seen many examples where I've had to get a second report done because the first report just was not up to scratch, that it missed things, it didn't mention certain things, and you then get a second report done and then you get the detail that you want and that's relevant and explains why that patient's got the pain they've got. So my advice to the patients that I see is, wherever possible, please try and get hold of your MRI scan. Get that on CD, whether you've had that on the NHS, whether you've had it privately, get hold of that CD. Also, get hold of and ask for a copy of the radiologist report. So don't necessarily rely on the report that the referring clinician has told you. So if you've seen, let's say, your doctor or your surgeon, they say, yeah, nothing wrong, it's all fine. Just to be sure, ask them for the radiologist report. So you've got all the information at your fingertips. As I say, put that information into context, but I always say to patients, get your CD, get your MRI scan images, and also get your original report. Ultrasound scans are great at looking at superficial structures in the body, so that means tissues which are near the surface of the body. So let's say, for example, it was a shoulder and I was suspecting there was some damage in one of the rotator cuff tendons in the shoulder. Ultrasound scans are a great investigation to have done. You can see individual fibre quality, which means, if it's a partial tear in that tendon or damage to that tendon, you can see the individual fibres, which you may not see on other things like MRI scans. Similarly, let's say a knee, if it was a case of a teletendonitis, one of the tendons at the front of the knee, ultrasound scans are a good investigation. And also for Achilles tendonitis in the heel and plantar fasciitis in the foot, cause of heel pain, ultrasound scans are a great investigation to have done. The other good point about ultrasound scans is that they're dynamic, which means that they can be performed as you're moving. So for example, let's suppose you have shoulder pain, but the shoulder pain only comes on in a certain position. Let's say if you lift your arm. The sonographer can actually scan you in that position or even as your arm's moving, and that will sometimes highlight damage which you may not see with other scans where you're just having the shoulder held at your side.
Thank you for watching this video all the way through. For effective treatment and advice for muscle and joint problems throughout the body at either of our clinics in Chigwell or Woodford, call us at Spine Plus to book an appointment on 0208 501 0937. You may like to know that we've made several other videos with information and self-help tips on specific problems, everything from tension headaches to heel pain. Some of our suggested videos are shown below, or you can search our playlist to discover more. We'd also be really grateful if you could like and share any videos you watch, and please subscribe to our channel by clicking on the subscribe button to be kept informed of our latest information. For more information on our clinics, click Find Out More to be directed to our website.